need to be aware of your risk factors for developing type 2 diabetes. Being aware of your risk factors means that you're also aware of what you can do to cut your risk for developing type 2 diabetes. Do you have a history of diabetes in your family? Are any of your relatives currently living with type 2 diabetes? Are you slightly overweight? Have you ever been diagnosed with high blood pressure? These are some of the risk factors for developing type 2 diabetes. Now that you know your risk factors for developing type 2 diabetes, what can you do to either prevent or at the very least delay developing type 2 diabetes? Well, the first thing that you need to do is you need to consult your doctor or healthcare professional. They can run various tests that will let you know what shape your body's in. They'll be able to check your blood sugar, they'll also be able to check your blood pressure, and they can check your A1C. Your A1C is your measure of your blood glucose level over the past 3 to 4 months. This gives doctors a really good idea of if your blood sugar levels have been elevated over this time period, which could be very indicative of having diabetes. B is for blood pressure. This lets the doctors know how your heart health is running. If your cardiovascular system is running at a normal pace, they'll really have a good idea of how your circulation is doing and how everything else is running with your cardiovascular system. C stands for your cholesterol. Now, I know a lot of times we hear things about bad and good cholesterol, but your doctors, they'll really be able to check the exact levels of that bad cholesterol for you. So knowing your numbers is really important, because knowing your numbers, you'll be able to prevent some of these painful and very serious complications that type 2 diabetes can bring along, such as vision problems, heart attacks, strokes, nerve damage. So it's really important to know your numbers for these reasons. You and your doctor will talk about various numbers such as your A1C. A good target number for an A1C is below 7%. A1Cs in the range of 6.5% and under represents someone who has not yet developed diabetes. Anyone at 6.5 and over is definitely someone that a doctor will look at as being diabetic. They'll also talk to you about blood pressure numbers. A good blood pressure number would be in the range of 130 over 80. This represents your heart health and how your cardiovascular system is doing. Following discussion of your blood pressure, you and your doctor will also talk about your cholesterol levels. Good cholesterol target levels would be, for an LDL level, would be less than 100. For your HDL, it'd be over 40. Lowering your risk for developing type 2 diabetes is not as difficult as it seems. Some simple lifestyle changes are needed, but you can make them, and it's important that you do in order to improve your long-term health. The important thing to remember here is that you're in control of what type 2 diabetes can and cannot do to your body. Knowing your numbers is the way to know exactly what you're going to do in order to prevent type 2 diabetes from taking your body and your life over.